Individuals and children with cleft lips and palate often experience stigma due to misconceptions about cleft. Cleft lip and cleft palate are birth defects that occur when a baby's lip or mouth do not form properly during pregnancy. Together, these birth defects commonly are called orofacial clefts. The defect is the second most common congenital craniofacial anomaly, with 1 in 600 births worldwide. GuardianTV had a chat with an oral and maxillofacial and cleft surgeon, Professor Mobolanle Ogunlewe, who threw more light on it.
Let me first of all tell you that there is actually a lot of myth that surrounds the cleft deformity, and I want to tell you and everybody that it is not as a result of any evil spirit. It is not because the mother has offended someone. It is not because the mother had eaten something or had done something while the baby was pregnant. What causes cleft can be divided into two things. You see, cleft is what you refer to as a congenital abnormality. That means the baby is born with it. It is not acquired. So as the baby is being born, the baby comes out with it. And this means that something must have gone wrong during the pregnancy of this child. And the causes, we can divide them into two, what we call genetic and then what we call environmental. It's an interaction of these two that actually lead to the cleft. And the genetic one, I can say, is an inborn error while the different parts of the baby is being formed. And if there is a genetic predisposition, this means that if somebody in the family has it, then there is likelihood that somebody in the generation or in the train of that patient will have it. If the mother has it, there's the likelihood that the son or the daughter too may have it. If the grandfather has it, there's the likelihood that somebody along that line will have it. The environmental factors are those things that the mother come in contact with during the pregnancy. And it is important to let us know that the baby, the face, is actually formed by the time the pregnancy is about 6 weeks, 9 weeks. The lip is about 6 weeks. The palate is about 9 weeks. So whatever the mother comes around along with during that time can actually lead to this deformation. And these things include some of the things that we eat, some of the things that we take in. There are some times that we may have some herbal concoctions. I'm not saying they are not good but we know that some of these things can actually result from it. There are some drugs that we take during pregnancy that can actually result in the cleft. Then if you have some radiation, if the mother comes across some radiations, come in contact with some type of radiations, there's likelihood. And then we know that lack of some vitamin, folic acid, particularly folic acid, can actually be responsible for the cleft. There are some factors that the evidence is very strong. There are some factors that the evidence about them is not very strong. But lack of folic acid is one that we know that it actually causes clefts. Then there are some drugs that you take during pregnancy, it can lead to cleft. Then there are some diseases that if the mother is diabetic in pregnancy, there's the likelihood of it. Age factor too has also been implicated. Probably if the mother is very old or the father is very old, that the child can have cleft. So there are multiple factors that are actually responsible. One of the challenges that a child that has a cleft lip and a cleft palate has is feeding. And this challenge is due to several factors. Because of the defect in the lip and the defect in the palate, the baby is not able to suck very well. The baby cannot latch on to the nipple. So he will require a lot of energy to suck before he can actually get the breast milk from the mother. Also, the defect in the palate also prevents the tongue from coming in contact with the palate. So the baby too will not be able to suck. When a child is born and is brought to a center, we first of all want to counsel the mother about this defect. Because what you observe, some of them, they have not seen the thing before, they have not heard about it before, and you can imagine how devastated they will be. So the first thing for us is not just to take them to theater and to start operating. We want to counsel them, we want to advise them on how to take care of the child, on how to feed the child, and then they have to see the pediatrician to examine them to make sure that they don't have any other defects. So those are the things that we do. before we consider surgery. And at 3 months, we repair the lip. That is, if the baby had gained enough weight, the baby is well fed, has adequate blood in the system, then we can consider for repair of the lip at 3 months. Then for the palate, we usually do that between 9 months and 1 year. Then the alveolus, we usually do that one at about 7 years. That is when certain teeth are already coming out. Because with the cleft of the alveolus, the children will have deranged occlusion, which also has to be managed. So the treatment will actually, that's the surgical treatment will actually start at 3 months, but the management of the baby himself comes as soon as the baby reports to us, with all the things I've told you: nutrition, counseling, and advice.